Okay, we are going to start our online seminar. Thank you very much for all of our distinguished guests from Taiwan, from Papua New Guinea. So good morning and good afternoon, ladies and gentlemen. Thanks to join today's online seminar. I'm Lina, the Director of Overseas Medical Mission Center of Changhua Christian Hospital. I'm also the moderator of today's seminar. So first of all, I would like to thank our distinguished guest participants from Papua New Guinea, from Taiwan, and of course, our two ambassadors and our four speakers, Dr. Hsieh, Dr. Chen, Dr. Richard, and Dr. Elizabeth. So before we start our seminar, I would like to invite our distinguished guest to give the remarks. The first, I want to invite the representative of Papua New Guinea Trade Office in Taiwan, Mr. Tommy, to give the remarks. Tommy, please.
Thank you, Dr. Nina. Good morning, Taiwan, and good day, Papua New Guinea. I am Tommy Kunji, the representative at the Papua New Guinea Trade Office here in Taiwan. Let me firstly acknowledge the distinguished participants. Dr. Nina Gao, CEO of the Overseas Medical Mission Changhua Christian Hospital, and the moderator of this online seminar, Ambassador Oliver Liao, the Taipei Economic and Cultural Office in Papua New Guinea, Councillor Li-Ling, Director Office of International Cooperation, Ministry of Health and Welfare, Taiwan, and our esteemed speakers, Dr. Chen-Pu, Dr. Chen-Ing Chen, Dr. Richard Kulau, and Dr. Elizabeth Alok. Distinguished online participants, guests, welcome online. Firstly, let me thank Changhua Christian Hospital and Port Moresby General Hospital. Another webinar to share experiences on orthopedic and cardiovascular surgery in Papua New Guinea and Taiwan. I would like to also acknowledge and appreciation and the Foreign Affairs of Taiwan for supporting this online seminar and also the previous ones as well. This seminar actually coincides with the completion of training for Doctors Kulau and Alok under the recently signed MOU between the University of Papua New Guinea School of Medicine and Health Sciences and the Changhua Christian Hospital. Therefore, let me acknowledge Dr. Damien Joseph Asola. I don't know whether he's online or not, but for initiating the discussions. And thank you to Doctors Nakafi Tepuarani, Dr. John Vince, Dr. Ikao Kebao, and Dr. Tipoki for signing this MOU with Changhua Christian Hospital. It's a step in the right direction and a correct deviation from the Waigani bureaucratic swamp where things are getting stuck and not moving. Dr. Kulau and Alok will share their experiences on orthopedic and cardiovascular surgery in Papua New Guinea and what they have learned in Taiwan during their training. We hope that their training and experiences will enlighten other Papua New Guinean doctors of what Taiwan can offer in terms of training and experiences towards their specialized training. And we look forward to having more Papua New Guinean doctors come to Changhua for training in the future under the MOU. Through the seminar, the presentations by our four esteemed speakers, we can learn of experiences and challenges of orthopedic and cardiovascular surgery in Taiwan and Papua New Guinea. I wish this seminar be successful and enable further collaboration and exchanges between Taiwan and Papua New Guinea, and more specifically, Port Moresby General Hospital University of Papua New Guinea School of Medicine and Health Sciences, and Changhua Christian Hospital. Thank you.
Thank you very much for Representative Tommy to give us the remarks and also to present what is the orientation, why we have this program and we sign the MOU. So we also hope that in the future, more of the doctors from Mosby General Hospital can come to General Christian Hospital to take the specialty training. So the next, I want to invite Councillor Liao on behalf of the Ministry of Healthcare to say a few words for us. Dr. Liu, 季间有在线上吗？
有 yeah.
Oh, okay, please. Thank you.
Okay, thank you. Yeah. Representative Tommy Kunji, Ambassador Oliver Liao, Dr. Nina Kao, Dr. Chen, Dr. Hsieh, distinguished guests from Papua New Guinea and Taiwan. Ladies and gentlemen, good morning. It's my great pleasure to attend the Taiwan and Papua New Guinea online seminar on orthopedics and cardiovascular surgery and welcome all of you to this event. I also would like to take this opportunity to wish you and your loved one good health in this pandemic era. PNG is one of Taiwan's crucial allies in the South Pacific region. Over a decade, the Ministry of Health and Welfare has worked with the Ministry of Foreign Affairs to conduct the PNG medical program. Changhua Christian Hospital has been working on this project, including mobile medical services, medical staff training, equipment donation, international patient referrals, etc. During the pandemic, Changhua Christian Hospital not only transformed the on-site clinical training, but received Dr. Richard and Dr. Elizabeth from Port Moresby General Hospital to take specialty training for 3 months. Today we are going to witness both doctors' training outcomes. I hope both doctors will apply the professional knowledge they learned at the Changhua Christian Hospital in their daily work back to Papua New Guinea. Lastly, I would like to take this opportunity to appreciate the Changhua Christian Hospital's continuous support and the contribution to building the relationship between Taiwan and the Papua New Guinea. Finally, wish you a successful online conference. I hope you enjoy it and may you have a good day. Thank you very much.
Thank you, Councillor Liu, and we also thank you very much for Ministry of Health and Welfare to support our program for over 10 years. So during the 10 years, they give us big hand to support this program and also to support our medical personnel training from Papua New Guinea. Thank you so much. So next, I would like to welcome Representative Oliver Liao from Taipei Economic and Cultural Office in Papua New Guinea to give the remarks. Dashi, please.
Okay, good morning, everyone from Taiwan and PNG. My name is Oliver Liao. I'm Taiwan's representative to PNG. It's a real pleasure for me to participate in today's online seminar focusing on orthopedic and cardiovascular surgery. I'm really happy that I'm able to physically join all these participants in Taiwan because I'm currently taking an annual leave back in Taiwan. And I also would like to thank the Changhua Christian Hospital and Peng Jian for organizing this seminar. And I hope all the participants will be able to benefit from today's discussion. And I also would like to acknowledge Changhua Christian Hospital for its long-term dedication in promoting exchange programs with its counterparts in PNG, including Moresby General Hospital and Nonga Hospital. Also, I take great pleasure in seeing the progress that Changhua Christian Hospital managed to make during the past a couple of years, especially when we're facing the hardship imposed by the current COVID-19 pandemic. I am aware that Zhanghua Christian Hospital, although they currently no longer send mobile medical teams to POMOSB, but they still manage to sign the MOUs with Hongjam and also the medical school of UPNG. And I would really like to applaud such magnificent progress made by Zhanghua Christian Hospital. In closing, I wish today's seminar a great success, and I look forward to more similar programs in the future, as these programs surely will help to improve the medical care in both Taiwan and POMOSB. Thank you.
Thank you, Ambassador Liao. So before we start our seminar, I want to invite our online participants to turn on your camera. We are going to take group photo. Thank you so much. Great. Okay. I remember in the end of April, Dr. Richard and Dr. Elizabeth fly to Zhanghua Christian Hospital for their 3 months specialty training. And time is flying. They are going to finish their learning courses and back to Papua New Guinea very soon. So today, we are going to witness their learning outcomes. So we have a short video to record their learning journey. I think the two docs, you never saw the video before. We will show this today. We have, so the short video will record their learning journey. So let's watch the video first. And I hope both of you enjoy your stay in Zhanghua Christian Hospital. Congratulations to graduate. Okay. So, okay, now we're going to move to our seminar. So the first speaker is from Zhanghua Christian Hospital, Dr. Hsieh. He is the director of Orthopedic Department. Dr. Richard follows Dr. Hsieh for the most of his training period. Dr. Hsieh will share the topic, limited getting along, limitless friendship. So Dr. Hsieh, you have 20 minutes to do the presentation. Now the floor is yours. Dr. Hsieh, please.
Thank you. I will present the course about 3 months with Dr. Richard from Papua New Guinea, and we take the information in the beginning of the 2022 about we will have the visitor doctor from Papua New Guinea. Believe me, it is not so familiar nature to most people in our country, but I know it. So we are very great to have the opportunity to communicate with the Dr. Richard from Papua New Guinea to talk about the experience and share the difference about the patient treatment and operation about orthopedic surgeon. The physical course is beginning from the 2022 May. We have morning meeting every morning in our department. So I invite Dr. Richard to attend our everyday morning meeting. He is always the first one arrived the meeting room. So I'm sure he is very serious about the training course. From the morning meeting, we built the beginning relationship with Dr. Richard and make a communication with Dr. Richard. We also communicated in the outpatient clinical. We talk about the difference of a patient who meant problems and the trauma situation in our country. Because my subspecial division is sport medicine, so we also talk about the athlete trauma and special treatment for the athlete training. Except the outpatient diagnosis and physical examination, operation experience is the key point to share for Dr. Richard. So we let Dr. Richard have the operator experience about the arthroscope. In recent period, the arthroscope have advanced development. So the arthroscope is not only for diagnosis, but also for treatment and can do many procedures. We show the arthroscope surgery to the Dr. Richard, which the surgery can do many procedures and can repair or reconstruction of ligament and the soft tissue. We also show the shoulder arthroscope experience for Dr. Richard. The shoulder is the site spot injury often occurred. Now we can do many precise repair procedure or reconstruction procedure by arthroscope to treatment the injury. The open operation can do it before. this is also the shoulder arthroscope procedure, and it can do many repair procedure more precise and little wounds. As I know, the joint replacement is also the key surgery Dr. Richard want to see. So we have several joint replacement surgery can show to Dr. Richard and let Dr. Richard have the chance to experience the real operator and by the in the procedure we talk about the operation skill and what should do and what not should do. As I know, some implant to treatment community fracture or serious injury is not available in Richard's country. So we talk about the issue about how to adjust the implant. We show the previous operation experience by the chance we give the suggestion to adjust and use present implant in Richard's hospital. We can also reduce the cost of the operation from thousands of dollars to hundreds of dollars. This also the adjust method to treatment same trauma. And my another subspecial division is hyperbaric oxygen. So we also show the Dr. Richard the hyperbaric chamber and how to treatment the hyperbaric oxygen. The patient who need hyperbaric oxygen. We talk about the indication and treatment experience. As I know, the Papua New Guinea is also an island country like Taiwan. So there are many visitors to your country, and some diving injury will occur after the diving visitor. So we suggest Dr. Richard can produce the treatment chamber in here in his country in future. We also let Dr. Richard experience the treatment of hyperbaric oxygen to feel the pressure in the treatment period. I believe the Dr. Richard will enjoy it. Dr. Richard also told to me he want to the treatment some children with the foot deformity, like this club foot, is popular in his country. So, but there is no suitable brace or correct method to correct this deformity. So I'm happy I am behalf of our department of orthopedic. We will send one set like this Dennis Brown bar to Dr. Richard, and Dr. Richard can carry the set to his hospital and help the patient of children. Okay, our hospital is Dr. Lambert built in the 1896. He carried the love of God to Zhanghua. Like our president of a hospital, Professor Chen, often remind us we should share the love and the care to the people and the patient who need it. Like the first book, John, in the Bible, the fourth chapter and the 11th section. My loved ones, if God had such love for us, it is right for us to share love for one another. Thank you very much.
Thank you for Dr. Hsieh. I think that during Richard in the hospital, Dr. Hsieh take care of Richard, not only in the professional knowledge sharing, also his daily life. Like share you the rice dumpling when our holiday. So I think that it's a very, very good friendship in the future, and also not only for the training. Under our budget, we also will donate some of the equipment to Richard and to Elizabeth to continue their learning in Zhangguosheng Hospital, and they can apply to their hospital. Okay, so the next speaker will be the Dr. Richard from Pomorsby General Hospital, and he is going to share the overview of orthopedic in Papua New Guinea, the challenges of improving the orthopedic condition at the hospital. So Richard, you also have 20 minutes. The floor is yours, please.
Greetings, friends. Thank you for this opportunity. Now, I've been tasked to give a talk, which I'm much obliged to. My time is only 20 minutes, so I shall only give you a glimpse of what practice is like for an aspiring orthopedic trainee in a developing country. So that's where I come from. It's roughly 4,400 kilometers apart. In terms of land size, PNG is 13 times larger than Taiwan. I guess that's the only thing we're larger than Taiwan for. To even talk about orthopedics in my country, let me highlight some background details to help put things in perspective. We have an approximate population of 10 million people. The GDP of Papua New Guinea is $26.6 billion, which is 26 times smaller than that of Taiwan's, which is roughly about $700 billion. 85% of our workforce is in agriculture. Our main industries are in extraction of gold, copper, oil, and gas. We also have agriculture, fishing, and export of cash crops. We export to Australia, China, Japan, and Taiwan. Our healthcare services in Papua New Guinea are inadequate and are almost exclusively funded by government. This basically means that they give us what they think is appropriate and you make it work. So if you fall short before the next funding arrives, you go into life support mode. There are very few functioning hospitals, and the current healthcare infrastructure is a combination of government, private facilities, and church facilities. Most of the healthcare facilities are in urban areas. Now, the birth of orthopedic surgery in Papua New Guinea began in 1995 with the onset of the university program in orthopedics. In 1998, Professor Ikau Kevau and fellow orthopedic surgeon Dr. Toki and Nina became the pioneers in the field of orthopedic surgery. Currently, if my memory serves me right, there are 10 orthopedic surgeons local in the country, 7 of which are locals. It includes Professor Ikau Kevau, who's a full-time teaching professor now. We have 1 retired orthopedic surgeon. We have 1 orthopedic surgeon in the military, and we have 4 remaining working public sector orthopedic surgeons. Now, these surgeons all attained their qualifications from the University of Papua New Guinea after various international overseas attachments in countries such as UK, Australia, Singapore, and New Zealand. Now, we also have 3 expatriate orthopedic surgeons, one of which was trained in Papua New Guinea and is now a teaching professor at the 2nd Medical School of Papua New Guinea. We also have a Polish, an orthopedic surgeon from Poland, who is also a priest, who works full-time at the public hospital. And recently I've come to learn that there is an Indian orthopedic surgeon who practices at the largest private facility in the country, which is located in Port Moresby. At our hospital, at Port Moresby General Hospital now, we only have 1 practicing orthopedic surgeon, Dr. Asa, after our other orthopedic surgeon was transferred to another hospital also within Port Moresby. Now, so how long does it take to get from medical school to an orthopedic surgeon? You spend 5 years in medical school, followed by 2 years in pre-registration using a provisional license. Then you also followed by 2 years of services to state as a licensed medical practitioner. Now, 4 years of general surgery training follows, followed by 2 years of service as a general surgeon, and finally getting to do another 4 years of orthopedic training to actually become a qualified orthopedic surgeon. It takes a minimum of 19 years to get from freshman to an orthopedic surgeon. However, there is an advantage. The advantage of this program is that all orthopedic surgeons in my country are general surgeons. So if you're not practicing orthopedic surgery, you can still utilize your general surgical skills to serve where needed. For the hospital I work in, Port Moresby General Hospital, is the national specialist referral and teaching hospital of the country. We have 2 orthopedic units, which combined, we have a total of 54 orthopedic bed ward. That's usually 79% occupied on any day on average. In 2021, we totaled 1,191 admissions. Our total outpatient clinic recorded 2,638 attendances last year. For the admissions to the ward, the average length of hospital stay is 7 days. We conducted a total of 914 operations in 2021 with a cancellation rate of 25%. Our perioperative mortality rate is 0.3%. Now, the challenges that I encounter usually in my hospital. One notable area of concern in our setting are the conditions surrounding the hip region. And this is a common challenge for any orthopedic trainee. Fractures surrounding the acetabulum, femoral head fractures, neck of femur fractures, osteonecrosis of femoral head, intertrochanteric fractures, and subtrochanteric fractures are all fractures that we encounter daily. Neck of femur fractures in our hospital are usually very unwelcoming diagnoses because safe surgical options for me are limited, usually by the non-availability of essential equipment, instruments, and consumables. However, DHS and cannulator screws have been done, but quite infrequently. Shoulder pathology is another concern of ours. Shoulder pathology in our hospital are rarely admitted to a hospital, and it's not because they don't occur. but more so because we are limited again by our interventional options. And the lack of arthroscopic equipment has been one of the more notable factors. Knee joint injuries, usually related to sporting injuries, are managed usually using conservative means. We share this responsibility with the Physiotherapy Department for management of these conditions. These procedures were once performed routinely in the days when Professor Ikao Keva was actively operating. Over the years, the dwindling support has trickled down to non-existent levels. Arthroscopic repairs would be our best option for management of such injuries. In terms of spinal surgery, in our practice, we are limited to emergency decompression of paravertebral collections via costal transversectomy surgery. This is done usually without augmentation or instrumentation, but it's the best we can offer with our limited resources. My Taiwan experience and observation, my stay in Taiwan and in particular Changhua Christian Hospital has opened new possibilities for me. I have observed more surgical skills to help build my arsenal of operating capabilities. Some necessities I have seen in acetabular fracture management are usually the available wide array of implants they use, the instruments that they have in their possession. And notably, a C-arm is very much an essential equipment to have in your practice. And obviously, more practice will give us better outcomes. For femoral head fractures, I didn't really get much of femoral head while here, but neck fractures, I was privileged to observe some of the new neck of femur systems that they use here, especially with the advantage of one of the anti-rotation screw that provides rotational stability. And then there's that bolt that maintains the reduction, followed by the plate that actually provides angular stability with one or two holes being locked in with 5mm locking screws. This system actually provides 100% more resistance to varus collapse as seen with previous systems of management of neck of femur fractures. For avascular necrosis or osteonecrosis of the femoral head, here in Taiwan, first choice of treatment is hemi-arthroplasty. I've seen a fair few of them during my stay, quite privileged. I've also had the privilege of observing almost all forms of arthroplasty days. Furthermore, I've also seen complications that are related to arthroplastic surgery. At least I am aware of the kind of possible complications, and I've been around to see how most of those complications were managed. And I'm quite thankful for that. The indications for arthroplasty here usually are of non-inflammatory degenerative conditions, including osteoarthritis and avascular necrosis, rheumatoid arthritis, correction of functional deformities, revision procedures where other treatment or devices have failed, and non-unions of femoral necks and trochanteric fractures of the proximal femur, also with head involvement that are unmanageable using other techniques. Those are conditions in which they employ the use of arthroplasty. Arthroscopic procedures. Arthroscopy can be a very useful diagnostic tool as well when dealing with joint pathology. For the knee, I was privileged to be with the Chief of Orthopedics, Dr. Hsieh, who was very kind enough to show me my first knee arthroscopy procedure. ACLs were either artificial or by autograft, usually a two-bundle procedure. Autograft repair was done utilizing the hamstring. I've always heard about it, never got to see one, and I was quite happy that I was part of the team that got to do such procedures while here. And once or twice we had to use the peroneus longus tendon for augmentation. I only got to see one PCL repair, but it was a very satisfying operation to watch. And I was also given enough opportunity to perform general examinations using the arthroscope and assisted with ACL repairs. Meniscal repairs were quite numerous. Shoulder surgery, I was shown arthroscopic procedures of the glenohumeral joint as well. Dr. Hsieh gave me opportunity to have a feel of the shoulder arthroscopy. He is an expert at the shoulder, and I appreciated his teaching during his operation. I also observed surgery for impingement, shoulder impingement, massive rotator cuff tears, slap lesions, Bankart lesions, frozen shoulders, and even ruptured long head of biceps tendon with the Popeye arm. And there are some basic things we need if we're going to embark on starting this service. First of all, to get an arthroscope, good irrigation systems, good consumables, and of course, lots of practice. In terms of spine surgery, I had the opportunity to observe some simple procedures that we may think about adopting easily. I saw them use the Wallant technique. Wallant is basically wide awake local anesthesia with no tourniquet. In this procedure, they use a combination of local anesthetic and epinephrine to induce anesthesia and hemostasis in the area of the surgical procedure. And the practice is the use of balloon kyphoplasty for reduction and bone cement introduction for stabilization of the vertebral compression fractures. And to my surprise, these cases are day cases. This patient gets to walk home on the same day. For the more complex spine procedures, such as seen in lumbar spine spondylosis, a combination of decompression, bone cage insertion, and instrumentation is applied. And this can be by minimal invasive means or mini-open, microscopic, or even endoscopic means. All these methods are available here at CCH, and I've seen a few of them. So my CCH experience at Changhua included, rightfully as mentioned by Director Hsieh, included operations, whether I was just an observer or I participated in the procedures. Also attending clinics, usually, but not exclusively, with Dr. Hsieh, Dr. Shan, and Professor Wang, who is the only orthopedic professor here. Ward rounds were usually with Dr. Hsieh. Clinical academic meetings are almost every morning, as mentioned by Dr. Hsieh, and it's 7:30 on the dot. Fridays are usually at the combined hospital grand rounds, which I have attended almost all of them. Other meetings which I attended were hyperbaric oxygen therapy meetings, and there were usual occasional religious Christian worship meetings, webinars that were organized by CCH, Overseas Medical Mission, and also workshops that were also organized, of which I will be attending one tomorrow. How has this experience helped me? This attachment at CCH has given me more than just a clinical experience. It has given me new ways of looking at improving in areas of efficiency, effective resource utilization, financial accountability, patient satisfaction, and also learning along the way accreditation of a division. My thoughts for the future. For arthroplasty, I believe is a very real possibility for Port Moresby General Hospital. We could start with bipolar hemiarthroplasty and then gradually move on to total hip, total knee, and hemi knee. Nothing hard about it. Arthroscopy services may take otherwise a little longer, from my personal opinion, basically because of the logistics and instrumentation and supply chain that's usually associated with it, and the learning curve may be a little bit longer. Spinal surgery, on the other hand, I don't think is very difficult. We can do this within a year. A C-arm would be a key start to getting these procedures going, starting with kyphoplasty, vertebroplasty. I mean, they could do them in a day here, a day case. We could do this also. Hyperbaric oxygen therapy, I think, will become a very important modality in the near future. As Port Moresby General Hospital embarks on going into radiotherapy, we will be encountering radiotherapy complications. Some of these radiotherapy complications are only curable by hyperbaric oxygen therapy. Now, how can we do this? Arthroplasty, arthroscopy, spine. What do I mean by how can we do this? We need to talk to people. We need to talk to companies. We need to talk to suppliers, and we need to talk to organizations. Tell them what we want to do. Collect the data. Show them our plan. Tell them how we plan to execute it and where their help is going to be needed. Once we are ready, ask our friends like CCH to help us with expertise. Bring them for a week or two and do the cases with us in our hospital. Only then we will get the ball rolling. Remember, a rolling stone gathers no moss. We must keep moving. And finally, I'd like to acknowledge a few people. First of all, I'd like to acknowledge my hosts. First of all, the Taipei Economic Cultural Office in Papua New Guinea for making the connection. Dr. Nina and her team from the Overseas Medical Mission Center for your flawless execution of this attachment. We really appreciate it. Dr. Mu Kwan Chan, the Superintendent of CCH and his executives, for your warm welcome to your hospital. I felt very welcome. Dr. Hsieh, Chen-Pu, and his staff of the Orthopedic Department, CCH, you have been so kind and patient with me. I will treasure the knowledge you have blessed me with. And finally, the government and the people of Taiwan for your kindness and hospitality. To my country, I'd also like to acknowledge Mr. Tommy Kunji and Albert Kopiap of the PNG Trade Office in Taiwan. I felt secure knowing you were within reach. Professor Teforani, Dean of Medical School, UPNG, for acknowledging the importance of this partnership with CCH. And Professor Ikau Kevao, Head of Surgery, University of Papua New Guinea. Your tireless effort in ensuring that this attachment eventuated. Secretary of Department of Health, Dr. Liko, and his chief, the chief surgeon, Dr. Oktipoki, for acknowledging this program. Dr. Molumi, the CEO and management of Port Moresby General Hospital and the surgical division of Port Moresby General Hospital. Thank you for your support. Finish?
Very excellent presentation, Dr. Richard. Yeah, and I think for Dr. Richard, this is not the first time to Taiwan. This is the first time, but not the last time. Yeah, I think I hope in the future you can come to CCH again. Yeah, we can arrange like the 1 month very intensive training courses for your more advanced training in the future. For all of the doctors from Moresby General Hospital, when you come to Johor General Hospital, we are most welcome. But not only one times, we wish that you can come back to learn more. Yes, this will be more helpful for all of you.